Hi, folks, and welcome back. This program has sort of taken off. People are responding with a lot of very good questions, and these are questions that you typically ask in a college course, and I promise there won't be a test, but it is probably worth your while to take a few notes or watch a lot of the information that over and over again as to what we're going to present here. If you do have a question on the next session, please send it to AskSam@ValAsta.net, and they're picking them up there, and then they send them over to me, and I'm able to go through those. So let's go ahead and get started. I've got one here from Terry. And this one seems to come up quite frequently once people get on this for cancer treatments. He's been on chemo since last October. His CT in March has shown improvement from the chemo 2 weeks ago. The cystic lesion in his pelvis appeared to grow, and his tumor markers in his blood have more than doubled. He's been taking ValAsta for the last 2 or 3 months. He will be starting another chemo treatment May the 24th. What is going on? I've had more problems since I started using ValAsta than I had prior to using it. I had hoped that it would make things better, but it hasn't. Well, the reality is you're probably feeling a lot better. But let me go through some of the observations that you are not alone in this. As a matter of fact, I've got 2 others here. It says, I have metastatic breast cancer, which has spread to the brain. ValAsta controlled and shrank my breast tumor to the size of a marble, but it unfortunately did not do much for my brain tumor, and it grew significantly. What is your explanation for ValAsta working so well in one place, but not the other? And I'm going to address that also. Here's one from CJ. It says, I'm attaching my dad's recent CT scan done May the 6th, stage 4 lung cancer with mets to the brain. Started ValAsta on the 15th of March. He gives the dose there that he's taking. It's 9 pumps for 6 weeks, then 12 pumps currently. But something does not make sense. When his brain tumor was at 27 millimeters, he couldn't walk straight, felt unbalanced, and needed a walking stick. A week after radiation, he was on ValAsta and gradually started walking again without the aid of the walking stick, and still continues to walk well, even though the CT report says the brain tumor has increased in size. Could the radiologist be wrong in saying the brain tumor has increased? Could this be what you said in your recent video about cancer tumor cell exploding, and this is what the CT is picking up? Let me explain what is going on here. When you have cancer, your CT scan and your PET scan cannot differentiate between inflammation and the tumor. Now, when the tumor resides there, the CT scan will pick it up, the PET scan will pick it up. But when the cancer cell dies, you get a huge inflammatory response from your T cells, your macrophages, your neutrophils. They begin to recognize the dead bodies on the battlefield, the necrotic cancer cells. So they flood it, just like a boil, just like an infected wound. And you get a huge inflammatory response, and that causes the tissue to swell. Now, the reason these people's symptoms are going away, and it appears that they're getting better, even though the CAT scan shows that the tumor is larger, and it's not the tumor. It's the inflammatory response to clean up the dead debris from the cancer that the cancer is dying. So there's a couple things to watch for. In the scans, you may see an increase in the mass or the volume that appears, and the oncologists always recognize it as increasing cancer. And their first response is, we got to get you with more chemo. The reality is it probably isn't. It's dead tissue. You are no longer at risk. So it's something to at least consider before you go to the drastic measurements of chemo or radiation or surgery. That's number one. Number two is you may see your CA numbers, your cancer antigen numbers increase also. The reason that is because when cancer cells die, they rupture. The cell membrane comes apart. And that rupture releases the cytosol and all of the cancer antigens that was intracellular. It was inside the cell. And all of a sudden, your bloodstream is flooded with a large concentration of these antigens that can now be picked up with your blood work. So your CA number increases with increasing cancer. You have an intervention, whether it's chemo, ValAsta, radiation. The cancer cell dies, but your CA numbers go up quite a bit. That is not indicative of the cancer growing. That's indicative that the cancer cells have died and all of the cancer guts have been expelled into your bloodstream. Now, what'll happen is it'll take several weeks to even a month or so, or a couple months, for your body to absorb all of that debris. And eventually, the pattern is that the CA number increases, you get a steep incline, a drop, and it'll start to degrade all the way back to normal. So make sure before you do anything drastic, you wait and see how this plays out, because the moment your CA number bends over and starts down, you're winning. The cancer is probably dead. And what they're seeing on the CAT scan is just the inflammatory response. Like I said, they cannot differentiate on a CAT scan, an MRI, or a PET scan whether that cancer is cancer, whether it's dead cells, or it's just inflammation. So let's always step back and look at these numbers. If your symptoms are improving, then your cancer doesn't stop its growth. You don't get your weakness back if cancer is growing. It's obviously taking you the wrong direction. But if all of a sudden your symptoms are back, you're no longer in a life-threatening condition. Now, the reason that a PET scan, which can show the viability of cancer cells, cancer cells take up a large amount of sugar. So when they add the radionucleotide sugar, it is more absorbed by the cancer cells, so it lights up with the cancer cells. The problem that we're now seeing, and there's going to be some reports come out on this here in the next few weeks, they see a huge sugar uptake if it's a macrophage from your immune system. So if you have a cancer cell here and it takes up that sugar, it's going to light up red. All of a sudden you have this macrophage that is eating this cancer and killing it. The cancer's probably already dead, but now it's cleaning up the debris. You get this huge pus infection, like inflammatory response. These macrophages take up sugar at the same rate as the cancer takes up sugar. It cannot be differentiated. Is it the macrophage that's taking up the sugar, or is it the cancer? So it may still light up even with a PET scan. So that all has to be monitored very, very carefully. And the whole idea is don't do something drastic until you know exactly, is it cancer or is it just an inflammatory response eating up the cancer dead cells, the necrotic cells? This is so important, and I am so elated that people are actually seeing this, because their cancer is probably dead and they're no longer in danger. So keep that in mind and make sure you ask your doctor about this when you go in and you talk to him about this. He needs to know this if he doesn't already. Regarding blood thinners, we've had several people that for some reason they think that the ValAsta is causing their blood to thin. In most cases, there's SED rates, there's clotting factors that you can run with your CBC, your complete blood work. ValAsta has no tendency to normally thin your blood. But what we do see that is happening is people who are on warfarin or heparin and they're artificially reducing their clotting factors. The reason their blood is clotting is primarily due to an endothelial inflammation that's causing the P-selectin parts of the platelets or the white blood cells to adhere incorrectly or not adhere at all to the wall of the arteries in the what's called the endothelial cells. Typically that's caused from reactive oxygen species. Typically you'll see it as an elevated C-reactive protein greater than 3, and that's what's causing it. Well, when you start taking ValAsta, that inflammation goes away. So you no longer have this phenomenon where the P-selectin is not adhering to the endothelial cell walls. And once the ROS is eliminated, your blood will, and you're still on warfarin or heparin or whatever it is that they're using to thin your blood, you'll see, obviously, your blood get thinner. It means you have to get off of your meds. You don't give warfarin and heparin to people who have normal clotting factors. That is something that everyone needs to think about very seriously. So we see it with diabetics too, with insulin and metformin. We've got another question here from Ray. It says, having survived pancreatic cancer by having a Whipple procedure, I was left with only half a pancreas, a missing duodenum and some intestines, or duodenum, depends on how you want to pronounce it. That is why I now have to take enzyme pills in order to digest food. He takes ValAsta, 3 pumps in each capsule, take each capsule with each meal, 3 capsules per day. That is the proper dose. Typically, he states here, cancer has returned in the form of multiple myeloma. What should I be watching out for when reviewing blood work results? My oncologist says there's no remission, but that he is surprised at my lack of symptoms. And by the way, I also have a low-functioning kidney, congestive heart failure, hypertension, diabetes. I really feel much better than I am. I love the optimism in this. A lot of that, the ValAsta is going to stop most of the myeloid type cancers because it's going to interrupt the stem cell activity in the bone marrow. That stem cell activity is promulgated from the hydroxyl free radical and also the non-radical, which is a peroxyl form, an organic peroxyl form. The ValAsta is very good at stopping that. Now, how he got diagnosed with multiple myeloma, obviously there's a lot of information here I don't have. But he would look at his complete blood work, his CBC. I would also watch your liver enzymes and make sure that you're not dealing with a fatty liver disease. That can also aggravate the testing of a lot of your blood work. But astaxanthin does no harm and may have a huge upside potential in keeping this at bay and minimizing it. I'd be curious to see if he's had cancer chemo treatments. Chemo will have a tendency to disturb the stem cell formation in the bone marrow and actually cause multiple myeloma and is in 87% of the cases after you've taken chemo, you will represent with cancer in 1 to 5 years. and it's typically the chemo or the radiation that actually causes that representation of a carcinoma. Next question. All of these, by the way, you can test for simply with looking at your C-reactive protein. You want to make sure that that's included. You have to request it of your doctor, but make sure that that is a very important part of your blood work. Now, they'll probably tell you it means nothing. That's because they don't know what it means. So the simple fact that they don't know doesn't mean it's not important, because it is very important in measuring your oxidative stress condition and your predisposition to getting an inflammatory disease. Valbona, can ValAsta cause hypothyroidism? If yes, can you explain briefly the mechanism of it, and what can it be done to bring the levels down eventually to normal? The hypothyroidism, ValAsta does not cause hypothyroidism. As a matter of fact, it runs it the other direction. It should normalize it. Unless there's an underlying trauma, something has happened. If you've had cancer of the thyroid and had treatments, it may have destroyed your thyroid from the treatment issues. But overall, astaxanthin is just a very powerful carotenoid, similar to beta-carotene. So it doesn't appear in any of the literature to have an adverse effect on your thyroid. Now, what it will do is it will normalize your thyroid in hyperthyroidism, and will probably require you to get off of some of the meds because your thyroid will start to become normal. Let's see, Darla, how long does it take to dry up the weeping ulcerations? What amount of pumps did the man lady take with IBC? I'm currently taking 18 pumps. I'm not sure who she's referencing here. We have hundreds of cases of open inflammatory breast cancer cases, open lesions. It can take up to about 30 days for the lesions to start to heal over. But we've now looked at it as applying the oil directly on the lesion. And that really aids in wound repair. So you might want to try that. It's a little messy because of the red dye effect of the ValAsta. What amount of pumps did the man and lady take with IBC? IBC can mean a couple things. It can mean inflammatory breast cancer, which is what this is. But we had started them out at 1 milligram per kilogram of body weight, or 1 milligram for about every 2 pounds of body weight. And in addition, the men get inflammatory breast cancer. 1 out of every 3 cases is male inflammatory breast cancer. So the men that have been taking it, and also the women now, but they've been putting the oil directly onto the open wound and taking it orally at the same time. And it works quite well when it does that, the healing, to stop the weeping of it. But you definitely do not want to get an infection anytime you have a skin break like that. So you want to make sure that you're on proper antibiotics, and you've got it. The antibiotic effect of ValAsta is one of actually presenting a barrier to infection. The oil that the astaxanthin is dissolved in acts as a barrier. Bacteria cannot penetrate that oil layer. It won't survive. What can you tell me about your product and the effectiveness with CMML? I think it's chronic I don't know whether it's multiple myeloma or whether it's just blood cancer. I've been taking it for a year now. To look at this, typically these chronic lymphomas, if that's what it is that he's writing here about, they start usually in the bone marrow. Some, like in my case, it was polycythemia vera. Very often it translates into multiple myeloma, leukemia, and then death. So if we can stop that inflammatory response in the stem cells and stop that mutation and the high level of activity in the bone marrow, then these cancers should be put into a hibernative state and should not be progressing. I would really like to look at his blood work and take a look. I'm not a doctor, but I would like to take a look at it. Here's one from Tim. It says, Sam, love your talks. At the end of last week's talk, you said no fructose. So that includes most fruits and veggies. Where can I find a list of fruits and veggies with zero fructose? Okay. Fructose is always an issue. And there's several things that's going to come up here, and I'm going to talk about all of them. In vegetables, the fructose content is so low, it's not of concern. The biggest problem we have is any fruits that have 4 grams of fructose per 100 grams of fruit can be a problem. So those are the things you want to look up on the internet. What fruits are high in fructose? There are dates, there's raisins, there's oranges, orange juice, apple juice. Most of them are fairly high in fructose. Bananas are marginal. They're 4.8 grams per 100 grams of a banana. The only reason that I don't throw bananas in that curve, it's an exception, is because of the high potassium levels, and most of us are deficient somewhat in potassium. There's another one that's coming out. When we look, all sweetness comes from fructose. Well, not all sweetness. When we have sweetness in our table sugar, when we have sweetness in our sodas, it's high fructose corn syrup. So fructose is, if glucose has a sweetness factor of 70, fructose is about 110. So that's where we technically get our sweetness from. Glucose itself, although glucose is used by every cell in the body, fructose is not used by a single human cell in the body. So fructose is actually considered a toxin. It has no nutritional value in the human body at all. Glucose, on the other hand, is used by every cell in the body, from the brain to the muscles to the organs. There are some sweeteners out there called the Fructooligosaccharides. So let me break that down. Fructo means the beginning of that molecule is a fructose molecule. And I'm going to draw one here on the board. Oligio means that it's more than 3. So, and saccharide just means sugar. So what we're looking at when we use that term, let's see if I can do this. You have a fructose molecule, and I'm not going to get into the chemistry of carbons, hydrogens, or whatever. Typically, it has an O bond called a glucosidic. It's attached to a glucose. This is called table sugar. It's 50% fructose and 50% glucose. When we eat table sugar, our bodies attack this oxygen bond here. Fructose goes to the liver, where it has to be processed and creates inflammation. Glucose is used by everybody, every cell in the body. This is food. This is what keeps us alive. This does nothing but create an inflammatory response. So, what is the polysaccharides? And the polysaccharides only mean, now this has a sweetness of about 100. Glucose alone has a sweetness of about 75. Now, polysaccharides means that you have at least 3 sugars attached. It becomes a trimer. A trimer, or tri means 3, mers means units of sugar, units. This is becoming a plastic. This is not as absorbable in the small bowel as this molecule is. This molecule is more soluble than this molecule. This molecule is more soluble than this molecule, until you get out here to about what's called a pentamer. You have 5 sugar molecules, they look like the pearls on a necklace. This is called a polymer. It's actually a plastic made of glucose or sugar or saccharide molecules. There could be a fructose in here, and then another glucose. And this thing will just keep growing, just like plastic. For example, if I take ethylene, these are hydrogens. Now, this is ethylene. How do we make polyethylene? Everybody's heard about polyethylene. We crack that double bond. So 2 of these would go to these are hydrogens up here. And this thing will continue growing. If I have 3 of these, there will be another molecule of ethylene attached. This is a gas. A tetramer of ethylene is a wax. It's almost becoming a solid. If I go all the way up and add 100 ethylene molecules to make this polyethylene, it's now a solid. It appears to be a solid. The same thing happens with glucose and fructose. These saccharides become totally insoluble and cannot be absorbed by the small bowel. It's like eating a piece of plastic. And that's the best analogy I can come up with. If you ate a piece of plastic, it goes all the way to your colon and cannot be absorbed. It's a solid. It's an inert solid. So these polysaccharides, F, G, 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 F, G, G. If I back out, it looks like almost like a string of spaghetti. That's a F, a G, 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 F, G, G, G. It looks like a pearl necklace. This cannot be absorbed through your small bowel. So this ends up in your colon. The polysaccharides, once they hit the colon, there are bacteria in our colon that cracks these, breaks them into much smaller molecules. So you got a molecule of F, G, G. We'll just leave that there. And then you have another molecule, big plus sign, of G, F, G, G. And then this could further be broken down into a molecule of F plus a molecule of G plus another molecule of G from these bacterial biotic organisms, not human, that live in our colon. It's called fermentation. So, since it's fermented in our colon, the fructose may not make it to the liver. But in any fermentation process, you're going to end up with some digestive disorders. You can end up with a lot of gas, because when this sugar is digested, the key component in aerobic digestion is carbon dioxide. So you're going to generate gas. You can generate methane from this. So we all know what flatulence is. But the other advantage of this is the energy that allows the biotic organisms in your colon to grow. So some of the polysaccharides can actually be food to increase the growth of the biotic, the good bacteria in your colon. And the downside is gas, maybe some diarrhea, because water is a byproduct of this. This goes to CO2 gas. So this is a gas plus water. And if your colon can't take that water out, you're going to end up with loose stools. But these are can be used as what's called a probiotic. So these polysaccharides, even though they contain a small amount of fructose, can be beneficial, because this fructose never makes it to the liver. These are actually processed and fermented into lactose, that can further be broken down. So the more of these prebiotic bacteria you have in your gut, the little better off you are. And this is the food for it, are these polysaccharides, not fructose. So I'm going to stop here for right now, and we're going to do a part 2 to this. But I want this to register. When I talk about fructose, I'm talking about the single molecule or a dimer, table sugar, where the very high percentage is fructose. Fructose is a real problem. This molecule will be absorbed in your small bowel and end up in your liver, causing fatty liver disease. These long-chain polysaccharides are not absorbed and do not enter into your bloodstream. These will form ROS and cause an inflammatory response throughout your body. These probably do not, unless there's a bacteria that's causing inflammation in your colon. So I hope that helps, and run the questions back in if you have any other questions regarding this. And this is a very, very important aspect of it, along with what we talked about, the difference between inflammation and cancer pictures on a CAT scan, an MRI, or a PET scan. Be very reluctant to take chemo or radiation unless you know for a fact that it's cancer and not inflammation. Please feel free to send your questions to AskSam at ValAsta.net, and we'll get to it. Thank you very much.